For our population-focused health assessment, we chose long-distance runners as we all volunteered at the Maine Marathon this past fall. What makes this population unique? The population we have chosen to focus on is long-distance runners. This can include runners of any age, gender, or race. During our experience with long-distance runners at the Maine Marathon, we specifically focused on caring for the athletes directly after the race, but this assessment is open to all aspects of assessing the health of long-distance runners. We find that the capability of long-distance runners to train, compete, and recover from intense levels of endurance, such as completing or attempting half or full marathons, is what makes them exceptionally unique. Maine offers many training groups for people seeking to run the Maine Marathon to help reduce the amount of injury. Some specific groups are Fleet Feet, Runaways Run Club, and Maine Track Club.
Demographic data, we found that exercise-induced collapse is often caused by the sudden discontinuation of exercise. So 59% of the medical tent visits by the runners were from exercise-associated collapse from a 12-year study. Many of the runners are able to be released after some rehydration. In addition, we have patients who are having musculoskeletal problems, accounting for 17% of the medical tent visits. The patients are at risk for musculoskeletal issues if they have a higher body weight because the force of the body hitting the pavement when running is estimated to be 2 to 3 times the body weight of the runner. And lastly is long distance runners are heavily affected by weather, as when the temperature is extremely warm, the patient is at a higher risk for being dehydrated. Dehydration is always a risk, but when the runners are expelling heat in the form of sweat, the runner is also losing their electrolytes. When a runner has hyponatremia, such as low sodium, they are at risk for dizziness, altered level of consciousness, and if it's severe, it can lead to a coma.
So for the interview portion of this project, we chose to read off a few questions that we felt best fit our population.
So the first question is, how did you train for the marathon?
I run 3 days a week. The 3 runs are generally a track workout, a longish trail run, and a longish run on asphalt. I also use a rowing ergometer 3 days a week, about an hour for each workout. Practice yoga 2 to 3 times per week, and strength train 2 to 3 times per week. 9 weeks prior to the half marathon, I switched the track session to long race pace intervals, 2 to 5 3-kilometer intervals with a 3-minute recovery, and stretched the duration of the other 2 runs, basically converting from 5K race training to half marathon training.
The second question was, what resources did you use to train?
I read about running fitness and endurance activities. I regularly meet with a small group of runners. We train together and have a cup of coffee together after the run. I draw from my experience. I've been a runner for 45 years and have participated in other endurance activities as well. I seek advice from other runners.
The third question that we had was, how would you say you are educated on the prevention of complications of this marathon?
My education in this area is generally in the form of bitter experience. Regular cross-training, yoga, and strength sessions help tremendously with injury prevention. Appropriate rest, such as only running 3 days per week, and good sleep, such as 7 hours per night plus 1 hour for each hour of training, helps prevent both injury and illness. I don't race in the heat or in the heat of the day. I also eat a big helping of oatmeal early on race day to help with glycogen stores. Thank you for taking the time to watch and listen to our presentation. We appreciate it.